And good morning to our early birds. Thank you for hopping on right on time / a couple minutes early. We hope you enjoyed yesterday with us and we're glad that you're back again. We'll get started in just a couple minutes. Let's see, Kimberly Stewart Lucas. Good morning, Kimberly. Good morning, Grace. Laura Cooper from our local councils. And I don't know if it is kind of drizzly and oaky everywhere in Georgia or just in the metro area, but I want to see everyone in person, but I'm also a little glad for virtual and not having to everyone trek out in this weather. I saw a couple of crashes on the way in. Rainy North Georgia. Thank you for that confirmation, Jeff. And in Augusta. Good morning, Pat.
I saw my dear friend, Debbie Hillman. Good morning, Debbie.
Again, for you guys just hopping on, thank you for being right on time. We're going to give it one more minute and then we're going to get going for this morning. And I feel like being virtual, I'm super happy to see everyone. I know yesterday we had kind of like all parts of the state covered of who was in attendance, every coastal area, every kind of edge or border of the state, and then all throughout. So it makes me super happy that we're able to have people who maybe would not have been able to come otherwise and make it an easy commute for you.
Great.
Good morning, Rebecca. Okay. So I'm going to go ahead and get us started. Welcome back to day 2 of the Georgia Conference on Child Abuse and Neglect, second year virtual going. And this year's theme is Digging Deeper, the Roots of Thriving Communities. So how do we get to that upstream primary prevention, looking at, of course, some of our typical topics here, but also kind of taking that broad scope and lens and social policy and justice within it as well. I just wanted to make another announcement again about continuing education and evaluations. You should have received an email yesterday at about 1:30, 1:35. If you haven't filled that one out and have it reflect the entire first day of series. So even if you filled out one on just one workshop you went to or something like that, just fill out that one and have it reflect all of yesterday's, the things that you went to in the workshops. And then today for evaluations and professional development, we are sending out an email at the end, again, at about 1:30 today. And that will be the one link that you use. And please fill it out for every session that you have attended for today. And that's how you'll receive professional development. So just one link today, and it'll be sent out via email to all participants at the end. And again, don't be waiting on pins and needles for that certificate. Give us a little bit so we can look at everything in the system, track who actually attended and the evaluations. And so if you have not received those certificates automatically to your email by the first week in October, then go ahead and give us an email or shout out to us. And we are so happy for our first plenary presenters today from the Center for the Study of Social Policy. They house the National Strengthening Families Initiative, as well as many others, and some great work. Here at Prevent Child Abuse Georgia, we took on the state Strengthening Families Georgia initiative in 2019. So we're super honored to have them and represent the national work and a lot of other things they do. I'm going to pass it off to our Strengthening Families Georgia coordinator, Soledad Tillman, to introduce our first speakers.
Hi, Mabu. Hi, welcome everybody. It is a great honor to introduce our speakers from the Center for the Study of Social Policies. Today we have Dr. Charlyn Harper Brown, and Cailin O'Connor. Dr. Charlyn Harper Brown contributes to research and the racial equity agenda that is foundational to projects within CSSP's Young Children and Their Families and Youth Thrives body of work. She strives to strengthen the knowledge base of practitioners, administrators, and policymakers whose work directly and indirectly can influence the healthy development and well-being of children and families. At CSSP, Cailin O'Connor works to promote better outcomes for young children and their families with a focus on promoting the protective factors that children, families, and communities need to thrive. This includes coordinating the Strengthening Families National Network of 35 states using CSSP's Strengthening Families Protective Factors framework and supporting cities and counties in their efforts to better support early learning throughout their communities as part of the Early Learning Nation. Thank you so much.
I am having a technical problem right this minute, so give me 1 minute, please, before I can start. Okay. Something is going on. Okay, here we go. First of all, thank you all. Cailin and I are extremely honored to be a part of this Prevent Child Abuse Georgia conference. And we want to start with thanking the leadership here for recognizing how important it is to have conversations about racial and ethnic issues. We hope that this is just one of many structured conversations that should be ongoing in your particular professional context. The reason for this is that people's beliefs about race and equity are complex and deeply felt. Thus, these topics cannot be addressed effectively through a one-time experience like this, although this certainly can be the beginning of it. Courageous conversations is what we like to call these kinds of conversations. But courageous conversations about these types of issues have to be frequent, ongoing, and handled with great care and thoughtfulness. So no doubt as we try to have these courageous conversations, there may be barriers like what are called distancing behaviors. So let's look at this thing called distancing behaviors. And Cailin, you're going to have to help me because my screen is totally black for some reason. I can't see what everybody else is looking at. So
oh no, okay, we're on the distancing behavior slide.
Okay, so you'll know when to change. So thank you so much. Distancing behaviors are often used in an effort to avoid dealing with very difficult and painful subjects like racism. Distancing behaviors are statements or actions that tend to deflect from the issue at hand, and that's exactly why they are used to deflect. Distancing behaviors tend to impede progress from developing, and particularly in an organizational context where people say that racial equity should be the norm. And so distancing behaviors should be called out thoughtfully, but called out and addressed when they happen. And so these are just some examples of distancing behaviors. Believing racism is a problem of the past, we are past that. That was back during slavery or during Reconstruction. When people say, I don't see color, I'm colorblind, that's a distancing behavior too, because that's dishonoring people's culture, people's race or ethnicity. Believing that racism is not the only problem. So let's focus on socioeconomic issues. Let's focus on poverty. We don't have to talk about racism. That's a distancing behavior. And then acting like it doesn't exist. And so even though people may engage in these kinds of distancing behaviors, issues around racial and ethnic inequity don't go away. They're right there in the room, even though we fail to acknowledge them, or if we do acknowledge them in a distancing sort of way, we deal with them superficially. In order to be active, though, in the effort to achieve racial and ethnic equity, we need to face the elephant in the room. Looking at the next slide, James Baldwin, I love this quote for in many different contexts. But James Baldwin said, not everything that is faced can be changed, but nothing can be changed until it's faced. And so that's what this effort is to do, is to begin for some and continue for others, to facing this issue about racism and where it fits within a context of Prevent Child Abuse Georgia. Let me also acknowledge that I'm using the phrase racial and ethnic because to make sure that we're being inclusive. This is not a black-white racial conversation. This is an all ethnic group kind of conversation that needs to be had. And some ethnic groups don't define themselves as races. And so I want to, as a racial group, let me say, so we want to acknowledge that we're saying both racial groups and ethnic groups here. So that's the context that we want to start with. So the content now. Sometimes when children, adults, and families are experiencing challenges or traumatic events like child abuse and neglect, we try to fix them, fix the children, the adults, the families, instead of working to fix the conditions, the events, the circumstances that contribute to poor outcomes, including challenging all forms of oppression and injustice like sexism and racism, et cetera. But racism is our focus, is the form of oppression that we want to talk about today. The analogy that I want to start off with is the analogy about the pandemic that we've all been faced with. As evidenced by the alarming number of preventable deaths that have occurred during this pandemic, because we have failed to intentionally and systematically, people have failed to intentionally and systematically take precautions to contain a disease. When that happens, it allows the disease to flourish and to persist. Similarly, failing to address racism, which is a disease, will allow it to flourish and persist. And our quest for equity, when we say we want equity, it will continue to be elusive when we don't address it. And so we want to frame this conversation in our understanding about racism in a social ecological model. And this is adapted from the CDC made this popular, but it really goes back to a developmental psychologist, Bruff and Brenner's understanding about how children are nested in the context of families, communities, and the larger society. So we want to use this 4-level social ecological public health model to better understand racism. The social ecological model is grounded in the understanding that there is a complex interplay between individual, relationship, community, and societal factors that put people at risk for violence or whatever problem they may be faced with. When you look at the overlapping rings in the model, that illustrates how factors at one level influence factors at another level, and that it's necessary to act across multiple levels of the social ecology at the same time. This approach is more likely to sustain prevention and intervention efforts over time than any single intervention or working at just a single level. So that's how we want to create a frame for this discussion about racism and anti-racism. Now, looking at the definition of racism, there are numerous definitions of racism. And one of the things that all of these multiple definitions have in common is a focus on the outcomes of racism, such as how racism tends to unfairly disadvantage some individuals and communities and unfairly advantages other individuals and communities. But the definition that I'd like to use relates to the conditions itself, to the conditions, the events, the circumstances that contribute to these outcomes. And so I want to just read this definition here, that racism is a complex system of beliefs, attitudes, behaviors, practices, policies, and laws that are born out of the ideology of white supremacy. And we look at white supremacy as the internalized belief of white people's presumed superiority and entitled power over other people and other races and ethnicities. Racism presumes a hierarchy of human value and regards whiteness as the standard against which races and other races and ethnicities should be compared. Now, I really think it's important to say here that this is not blaming. This is not a blaming conversation, and but that is the definition. That is one of the many definitions of racism. So now let's look at the at racism in the context of the social ecology and these 4 different levels. This first level that we want to look at is what we're calling interpersonal and individual racism. That and it comes in 2 forms. Personal racism, and this one is one that we are all familiar with, where people have stereotypical, prejudiced, or biased beliefs and feelings about other races or and ethnicities. So that's a personal, individual kind of racism. But it comes in another form too, that when people accept racist beliefs about their own group, that's what we call internalized racism. So this first form is one that we are, most people are very familiar with. And so is the second level. The second level being interpersonal or relational racism. And at this level, we're talking about verbal and nonverbal discriminatory interactions between individuals, such as racial profiling, discrimination, and this thing that's often called microaggressions, where we're talking about intentional or unintentional assaults that people receive. And they may appear to be harmless or even seem like a compliment. For example, telling a Black person of color or another any other person of color that you are so articulate, as though that's a surprise, because you generally have a stereotype view of that particular group as not necessarily being articulate or very intelligent. So saying that is a type of microaggression because it's related to some type of implicit bias that you're holding. Microaggressions can contain demeaning hidden messages that often stem, from these stereotypes that people hold. But it's very important to acknowledge that there's nothing micro or small about microaggressions. Microaggressions can have a serious impact on the people the people that are being aggressed. And so they should not be dismissed. And it ends up calling people to feel, anxiety related symptoms, and just, when it happens at work all the time, it can cause burnout, et cetera. So that's why we tend to say, the micro part in quotation marks, because there's nothing really small about it. It can have a profoundly negative impact on people. And then looking at this third level of the social ecology is what we are calling the institutional or community racism. And these are discriminatory policies, procedures, and treatment in organizational and community contexts, such as organizational and community contexts like schools, workplaces, healthcare facilities, courts, etc. And so I want to show you a cartoon that to me exemplifies provides an example of institutional racism. And here it's experiencing our Americanness differently. One of the effects of racism is that different racial and ethnic groups tend to have different experiences and reactions to the very same events. So this illustration here is how a white cartoonist named Ben Sargent illustrated this point. It's a cartoon that he labels "Steal Two Americas," and what you see here is that there's a picture of a white boy, a little white boy, and a same age type black boy, and they are both yelling out to their mom, that they're getting ready to go outside. But the mother's reactions are very different. The white mother's reaction to her son's statement is that, put on your jacket, going out, have a good time, blah, blah, blah. But the Black mother has to frame this in the context of racism to protect her child. She says, put on your jacket, have a good time, but keep your mouth shut around police. Don't wear a hoodie. Don't give them an excuse to hurt you, and things like that. And so what this cartoon illustrates is that this often overlooked source of stress and racism that some sociologists call chronic environmental stress that's experienced by members of ethnic minority groups. And it's defined, if you look at this definition here, it's a constant background level of threat in the environment. It includes things like racism, economic inequity, and other forms of oppression, as well as the heightened danger and the intrusion of social problems into everyday life. Chronic environmental stress impinges on people's optimism and sense of control. I'm just going out for a run and I get stopped and I end up dying, getting shot. This possibility that something is may happen to me simply because I'm driving while Black or running while Black. That stress, can impact your sense of control over what happens in your life. So that's one example of institutional or community racism. Another one is what has been called adultification bias. And let me just quickly explain that although children in many societies are viewed as a distinct developmental group characterized by innocence and in need of protection, numerous studies have found that these perceptions are often not ascribed to Black, Native, and Latinx children and youth. These children tend to be viewed as older and therefore should be held more accountable for their actions than their same age white peers. So when authority figures have distorted perceptions of Black, Native, and Latinx children and youth as less childlike, this is what's called adultification bias. Several studies have yielded data that's suggestive of adultification bias in multiple fields like education, child welfare, juvenile justice system, and these examples in these different systems, these different contexts, result in unjust treatment of these children. Just looking at some examples on the next two slides. For example, we see it is so amazing that you can see it in even preschool. For example, the studies have shown that approximately, although only 20% of female preschoolers are Black, they made up, in 2019, they made up 54% of female preschool children with one or more out of school suspensions. So, I mean, that just sort of, the fact that you're even suspending preschoolers is amazing to me, but that discrepancy, that disproportionality is suggestive of adultification bias. Several bodies of research have also documented numerous examples of disproportionalities and disparities in the child welfare system related to abuse and neglect. Black families are over-reported to Child Protective Services for suspected maltreatment. Black children were 14% in 2019 of the child population, yet 23% of children in foster care. The similar kinds of things, disproportionalities for Native children and Alaska Native children, who accounted only for 1% of the child population, yet they made up 2% of children in foster care. So these examples go on and on and on. Just for the sake of time, we're going to skip through these examples, but you all will have access to these to the slides, and you can read more about it. And we provided where this data, where you can find this data and read more about it. So let's look at this last level. This called systemic or societal racism. And here we're talking about historical and current macro level ideology, values, norms, laws, and policies that promote and sustain inequities in the functioning of systems and in their outcomes. Public policies, for example, public policies that have systematically, removed Native, Black, Latinx, and Asian peoples from their homes. We have all examples all through history of Black children, Native children, Latinx children, Asian children being taken from their homes and in their communities. Many practitioners and policymakers, decision makers, and human services systems operate in a manner that another example is when these systems fail to properly distinguish between poverty and neglect, thereby unfairly punishing families who are experiencing poverty, in particular, families of color. That's an example of systemic racism, and ultimately harming these very children. That, there's a movement now from federal down to local that are saying we've got to begin to incorporate and consider more strongly poverty and in our definitions of what neglect is, and not saying to make sure that we are differentiating poverty from neglect. So that's a positive thing to do, but that it's been done for so long clearly is an indication of systemic racism. Just to close that out, a family's inability to feed, clothe, and house their children should never be perceived in and of itself as neglect. It certainly could be an example due to poverty that's due to other systemic factors. So let me go on and wind this up a little bit. The next couple of slides talk about the frequency of the experience of racism, and just to say that that when a body of research that was very shocking to me was that when looking at the occurrence of racism in the lives of Black adolescents, and there was this particular study showed that that Black adolescents tend to experience 5 experiences of racism per day, whether it was direct racism, vicarious, online, teasing, etc. And that these students tend to have, it impacted them, and they could display depressive symptoms, and racism can have a profound impact on the health and well-being of children, adults, families, communities, and the society as a whole in multiple ways. And so the next couple of slides talk about that as well. But I want to sort of skip over this, leave it to you for your own digesting, and so we'll have enough time to talk about. So what do we do now? We now is the time for each of us to do our part to try to eradicate racism within the country, and at all levels of the social ecology. Only then will children, families, and communities be able to fully realize the positive impact of building protective factors, etc. There is, I was very, very proud of the American Academy of Pediatrics that issued a report that I think that everyone should read about the impact of racism on children, and when calling to arm pediatricians and other people in medical fields, but actually it's a statement to all of us, whatever context that we are working in, that we have to actively and intentionally try to dismantle racism. And the first step in doing that is acknowledging that it exists and doing something like we're doing right now, facing it and trying to begin to talk about it and have these have these kinds of opportunities to talk about it. One last thing I'll say, and then I'm going to pass it off to my colleague, Cailin. One of the things that you often, that I continue to see in the literature is talking about the risk factors for racism. And one of the risk factors that's often used is race. And if nothing else, I'm hoping that you will take from this conversation that my race is not a risk factor. My race does not place me in jeopardy. What is a risk factor is how people respond to my race. So the perceptions, the assumptions, and the treatment of me by people, and I'm using me in a collective context, the perceptions, the assumptions, and treatment of me by people, institutions, and the larger society because of my race is what is the risk factor, is what places me in jeopardy. And so that's, that I'm saying that to say that we've got to reframe, not only talk about these issues, but also reframe them, reconsider how some of these negative racist ideas that we've had about these issues in the past. So how do we do that? We begin to talk about anti-racism. So take it away, Cailin.
Beautiful. Thank you, Charlyn. Charlyn is a hard act to follow. I think everyone can agree with me on that. And I'm just thrilled to be able to do this presentation with her. I'm going to be talking about anti-racism, and I want to start by just showing a few definitions of anti-racism, and then I'll share the one that we use, our working definition at CSSP. But I wanted to start by acknowledging, as a white person, it took me a really long time in my life to realize that I should be one of the people having these conversations. I should not be the only person leading a conversation like this, and I'm thrilled to do it alongside Charlyn and with her leadership and in partnership with other colleagues, particularly Black women and other colleagues of color that have helped to develop a lot of the content that we're sharing and pulling from today. But as a white person, for a long time, I kind of thought, I'm not racist. I'm just here, not part of the conversation because it's, about racist versus people of color, kind of, and I knew which side I was on, but I didn't feel like I had a role to play in that conversation. And in the past 5 years, I've really woken up to the fact that unless white people are part of this conversation, we're not going to make the changes we need to make. And for me, it's been really helpful to really dig in on anti-racism as opposed to non-racism or just a more passive approach to equality, saying everyone should have equal opportunity, and that's enough. But really digging in on anti-racism. And so I'm coming from a place of humility, of understanding that I'm relatively new to this conversation, and I'm newer than I should be to this conversation, but I'm very, very honored to be part of it and to be able to bring some content and hopefully help some of the other white people in the audience see what kind of role we can all play and what kind of role we all need to play to really change these things in our society. So what you see on the screen, which you've probably been reading while I've been rambling on, are a few different definitions of anti-racism from different perspectives. I'm not going to read through each of them, but I'm going to then show you where we've landed at CSSP on our working definition. And I will read that to you. So we define anti-racism as an active process of identifying and challenging racism and redistributing power in an equitable manner by changing policies and practices within systems and organizations, as well as individual beliefs, attitudes, and behaviors. So what I'm going to talk about today touches on all of these things about policies and practices, as well as beliefs, attitudes, and behaviors. But with this definition, I want to focus on a couple keywords. They're active. This is not just, we're not going to do the racist things. It is that we are going to do different things to counteract and challenge the racism that exists in so many of our systems. And it's about redistributing power. So it is not, it's not a cost-free activity to be part of, right? It's not just saying, oh, everyone should should have equal access. There are things that need to change, and that means redistributing power. It means redistributing resources and access to resources in ways that are more equitable than it has been in the past. So I am going to jump into how we have kind of spread these ideas of anti-racism across the social ecology, parallel to what Charlyn just shared with racism. And I will say out loud, because some of you might not have seen it in the chat, that I did put a handout in the chat that summarizes all of this social ecological model of racism and anti-racism. So if you haven't been looking at the chat, go in there and scroll up. You'll see the file posted. And that'll be on our website before too long. So we're going to start again at the intrapersonal level, the individual level. And when we think about an anti-racist approach to the world, this is really where we need to start, which is thinking about giving serious personal reflection to counteract the racialized ideas that we have all just soaked up from living in this society. So those can be ideas, feelings, and attitudes. And the two things that I really want to highlight here are understanding how our own racial socialization and identity have shaped our personal life experiences and how they've been influenced by our life experiences. So whatever your identity is, your racial, ethnic, and here we even get into your gender identity, your sexuality, your ability, your immigration status, the languages you speak, all of that is shaped by our personal experiences and shapes our personal experiences because of how the world perceives us. So really understanding that, no matter where you identify on any of those categories. And then examining the personal impact of living in a racist society. I think for me, it was really mind-opening about 5 years ago to attend a training called Undoing Racism from the People's Institute for Survival and Beyond. And one of the biggest takeaways from that training for me was living in a racist society is dehumanizing for everyone who lives in it. Living in a system that values and devalues people based on their race actually makes us all less human. It takes away from our deep experience of humanity. So understanding the impact that this had on you. Now, for a person of color, examining the personal impact of living in a racist society might feel pretty straightforward, right? Like, yeah, I know what I've experienced, but there might be some room for reflection on not just the things you've experienced, but the ideas that you may have absorbed, stereotypes you may realize you hold even though you're uncomfortable with them, that it affects us all to swim in this water of the racist society that we all have grown up in. So that's the intrapersonal level. And really, like I said, this is where you need to start. I don't think that any of us can be very effective on these other levels unless we've done this reflection. So then we get to the interpersonal and relational anti-racism. And in contrast to the examples that Charlyn shared about racism at this level, here we're talking about verbal and nonverbal interactions that are characterized by appreciation for everyone's unique identity and not acting on assumptions or making assumptions about people based on however you perceive them. And here we did list all those, not all, but several other categories of identity that might influence how we make assumptions about people, because we do always want to acknowledge the intersectionality of oppression and privilege, and the fact that people exist with all these different identities in the world that all interplay to affect how people are treated by others, how they're perceived by others, how they move through the world, even though we're mostly focused on race today. Another really important part of interpersonal anti-racism is willingness to apologize and to recognize when you may have caused harm or you've been part of a system that has caused harm, and how you can apologize for that, make reparations, whether that's on a personal level, on an organizational level, but really recognizing and making up for harm that may have been caused. Okay, so then we're moving out into the community. And when we think about institutional and community level anti-racism, we're looking at an active process, like we said in our original definition, an active process of recognizing and eliminating those kinds of discriminatory policies, procedures, and practices that Charlyn was talking about, and really looking at contexts where we can create and sustain equitable access to power, privilege, opportunity, and resources. And this is about some things that that I think we've all been striving to do for a while, of making settings accessible and welcoming, but also making sure that when something goes wrong, we have a swift response to it. So we don't shrug off a particular staff person who might be exhibiting some interpersonal racism in the ways that Charlyn described earlier. We don't say, oh, that's just so-and-so and they'll retire eventually, right? Like, we actually respond to those actions and take action to make sure that harm isn't done and to repair any harm that has happened. Also really actively looking at policies, procedures, and practices that we can implement to replace the harmful ones, or to make up for some of the harm done by policies, procedures, and practices in other places, right? So people are coming to us and we want to have policies, procedures, and practices that can repair some harm done, even if it was outside of our own organization or community. When we get to the systemic and societal level, we're getting into that ideology and the values and laws, norms, like Charlyn talked about it with racism, but we really want to have all of those things creating and sustaining equitable access. And as I said before, it's that access to power, privilege, opportunity, and resources. And so that comes from a fundamental belief in and honoring of the humanity and rights of all people. As I said, living in a society that is racist is dehumanizing for all of us. And so you need to think about the ways in which some of our policies dehumanize people, and some of the ways that we may see that happening and accept it, or think it's wrong, but not think it's our place to do anything about it, but we need to start doing something about it. So acknowledging the racist roots of a lot of the systems that we operate in right now, and then taking specific efforts to counteract those. A lot of times we don't think that much about the history of our systems and our communities and our population groups, but we need to know that history. We need to understand the effect that it still has on people and systems today. I think our American culture tends to say, let's focus on the future. Let's not worry too much about what happened in the past. And yet we know how much the shadows of what's happened in the past are still affecting us today. So we really need to understand that. And we can't make the right changes unless we really understand what went wrong in the first place. Then we also want to have a true commitment to directing resources and supports to people or communities who have been harmed by racism historically and currently, having new strategies, thinking about new strategies to achieve goals like public safety and child protection, where we know that the systems we have, some of the statistics that Charlyn shared really shed light on that the systems we have do have racist roots. They are operating in ways that perpetuate disparities, and we need to think differently about how we achieve the goals of those systems, the goals we have for those systems now, as opposed to the goals that were in place that informed how they were set up in the first place. So really taking time to understand that history and then to do something different sometimes means saying, let's, at least as a thought exercise, let's not just think about our current existing system and what small changes we could make, but rather, like, if we want to live in a society where children are protected from harm, what does that take? Let's not talk about the CPS system we currently have, or even the prevention systems we currently have. Let's just talk about what would it take for a community or society to be a place where children are safe and protected from harm. That might lead us to some really different conclusions than the systems that we're currently trying to change around the edges. And then whether we can make those changes is a different question, but we need to at least be thinking about what those would be and then how we can start to achieve them. And then I think really important is the last bullet point on this slide about leadership by individuals and communities who have been harmed and alongside individuals and communities who have been harmed. We want to see people of color, of every possible culture and background and identity stepping into leadership roles. That doesn't mean there isn't a role for white people, but it does mean that when white people are in leadership roles, it needs to be alongside others who bring other perspectives and have had different experiences and bring that into the work to make, to design systems and implement strategies that can really make a positive change. So one of the things that we're trying to do through conversations like this and other work is normalizing anti-racism. And I think we run the risk of something becoming a buzzword that people still don't really understand. I think for a while it was sort of like, okay, are we supposed to say anti-racism instead of equity now? Is that kind of just the new word? But it really does mean something different. It's been helpful for me. As an aside, I'll say as we were finalizing the definition of anti-racism, we've also been doing a lot of work to update materials that we had that are focused on equity, where we weren't using language around anti-racism as often as we are now. And so we really had to look hard at how we talk about these things. And the insight that was really helpful for me was that equity remains the goal, whether that's racial equity, social equity, other forms of equity are our goal. But anti-racism is a strategy. Anti-racist policies, anti-racist strategies, anti-racist interventions are the way we get to equity. So I really prefer thinking about anti-racism as the active process that gets us to the goal of equity. And if you find that helpful, go ahead and use it. If you don't, type it in the chat. I'd love to hear your thoughts. So part of normalizing racism is really understanding that, working it into our language in ways that make sense, but really using it as a core value and being really intentional about taking actions that we know will advance equity by addressing past harms and by replacing harmful policies with better ones, all of that. So at CSSP, we have what we call an anti-racist intersectional frame that we use to shape our own work and our thinking, which we have made available on our website. You are happy to use it if it's useful for you. We've done some workshops with other groups really digging in on the anti-racist intersectional frame. So today I just wanted to refer to it, that it is just a 2-page document. Those 7 bullet points on the second page are a big deal that I'm going to share on the next slide. Those are where we really are trying to dig in on what it means to do the kind of work that we do on social policy, but other work as well, with an anti-racist approach. And I wanted to acknowledge the references there. Ibram X. Kendi's book, Stamped from the Beginning, and also his book about how to be an anti-racist, but a lot of what we pulled from the frame are from his book Stamped from the Beginning. And then Sarah Mader about using an anti-racist framework in social work. So those 7 bullet points are up on the screen here. I'm not going to go through all of them, but just want to share that what we're doing with this frame is really trying to make sure that we're asking the right questions, whether we're writing something or preparing a project proposal or planning out how we're going to do, a piece of work that we are going to do. When we're planning out the details, we need to make sure that we're paying attention to all of these things. So we're thinking about the social effects of racism. We're thinking about intersectionality. We're calling out white supremacy and white privilege. And that calling out is very specific about not letting things go unsaid that have often gone unsaid and therefore unaddressed in our work and in our society. Really, the other one I want to point out is number 6, about questions the motivations of traditional institutions. And that again is about saying, what is the goal that we have for children or families? And are the institutions and systems that currently exist getting us to that goal? And if not, is that because they were set up with a different goal in mind? And oftentimes we know with traditional institutions now, that is the case. They were set up with a goal of controlling the Black population, or maintaining privilege and access to resources for the white population, or lots of other, it's not just about Black and white, but calling out those examples as ones that we can see in a lot of our institutions today, that we need to question those motivations, and then that gives us what we need to know to make changes to them. And I encourage you to check that out. We actually have some recorded webinars on our website of talking about the intersectional frame in more detail. So if you're curious, there are ways to learn more about that, or send us an email and we will be happy to engage in a conversation about that. So I just want to take the last few minutes we have here to talk about protective factors and how this all fits in the social ecology of racism. So we know that risk and protective factors exist across all of these levels in the social ecology. And when we also know that racism has had such an influence and continues to have such an influence on all of these levels, we want to stop and think about what that means for our work on protective factors. And so we have always been working from an understanding that the protective factors that we talk about in strengthening families, which are listed here if anyone is not familiar with them, but I think most of you are, because Georgia is one of our rock star states that does great work on strengthening families. So these protective factors we believe to be universal. So it's not like if you flew halfway around the world and were talking with families in a completely different culture, that you wouldn't still see signs of all 5 of these protective factors, and they wouldn't all still be relevant, but they might be understood and expressed and manifest in culturally specific ways. So depending on whether a culture is, very collectivist or very individualist, depending on, just cultural traditions for how adults relate to children, things might look different, but these protective factors are still present and would still resonate with parents if you describe them and dig in on what that looks like and ask them, what does this look like in your family? So we believe these are culturally specific in their manifestation, but universal in that they are true about what children and families need and strengths that families have. But we do want to make sure that when we're approaching our strengthening families work, we're not assuming that social connections need to look a certain way or that parental resilience needs to look a certain way, because it might look different in different cultures. You don't have to fly halfway around the world to find a family that operates differently than yours does, and that might have some different cultural background that they bring into how they express these protective factors. So when we think about strengthening families, advancing anti-racism, and this is work that you're going to hear more about over the next year or so if you tune into Strengthening Families webinars and other work, is we're trying to articulate more the ways that strengthening families can advance racism and has been advancing anti-racism in a variety of settings, then in ways that we haven't always articulated before. But the core basis of strengthening families has an anti-racist approach to it already, which is that it's about recognizing that all families have strengths and all families need support. No stigma, no stereotypes around who needs support and who has strengths, but that everyone has strengths and everyone needs support at different times and at different intensities throughout their lives. And implementing strengthening families is really about overcoming individual bias. So really engaging with each family, seeing them holistically and acting on the strengths they have rather than on assumptions about them. Strengthening families when implemented well is really about designing programs, policies, and systems with a focus on strengths, and especially the strengths of families who have been marginalized and who haven't always had their strengths recognized by our systems. So we do see that as an anti-racist strategy when it is implemented the way it's intended to be. And of course, partnering with parents to find the solutions that work for their families and for their communities, so that they can say, the way this has been working is not working for us. and for my family and the families I know, it would work much better if we could do this. So really meeting people where they are and advancing policies and strategies that work for them in ways that are systems that have been infused with racism have not always done, or have definitely not done. So with that, I want to share one more quote, and I think Charlyn might want to come back on to share this quote from Angela Davis.
You could say it. You really could say it, because you're doing this, and I greatly appreciate it. One of the most important moments of my life was when Angela Davis was a fugitive back in 1970-71. I had this huge red afro, and I was stopped by the Georgia State Patrol when she and accused of being Angela Davis, and I was just so very proud of that. And so when I saw read this quote, I was delighted to read it. And so she has sort of flipped the script on saying, what is the Serenity Prayer? She sort of flipped it around and said, I'm no longer accepting the things that I cannot change. I'm changing the things I cannot accept. And yes, this is from one of my favorite people, but the next time we do this, Cailin, I would be honored for you to read this, because you are doing this. And this is why also that is very important for both me and Cailin to be a part of this kind of discussion. When people move in the direction of anti-racism and make a commitment to anti-racism, you look, this is what happens to you. And Cailin has definitely told you about her journey, and I can say for sure that she clearly is on this journey. So you read it the next time, okay?
Sounds good. Thank you. Thank you all. I'm scrolling through the chat comments that I missed while I was talking. And I'm going to hand over to Jill to say if we have time to respond to any questions or anything.
We've had some really great dialogue and chat and just affirmations for our amazing presenters here today. We definitely put a lot of thought on who we wanted to present, and especially around this subject. And we couldn't think of anyone best than our national partners to come do this and present for us. So a big thank you, guys. And we're holding the questions because Cailin and Charlyn are actually going to be in the 9:30 session, just doing a lot of discussion with you guys and some reflection into this. So all those amazing questions that you guys had, hold on to them and join their 9:30 session. We will be there. Let me share with you really quickly our upcoming ones, and then we'll head off. So again, we have a continuation of this discussion, and then we have prevention and policy with Polly McKinney. At 10:40, we have Is That Normal? Healthy Sexual Development in Kids, and a continuation of the first day's keynote, The Art of Framing. And we have a little networking event where we're going to do an inclusion conversation. And at 12:30, I think what you guys said this morning was so important, that we need to stop trying to fix children and families and to look at the system that has not supported them or has even been oppressive towards them. And we have Angela Tejada Banks, who is discussing on Save the Family, the unspoken effects of family separation. And so her message is to not save the family, but look at it differently as well. So thank you so much. And we'll see you guys in the 9:30 sessions. Bye.
Thank you.
Okay.